Hi everyone, and very good evening to all of you. First of all, a very warm welcome to all of you who have joined today. And the discussion is all about the second year students. Before I move forward, I want you all to tell me whether the audio and video is fine and okay. Can you see me clearly? Can you hear to me, listen to me carefully or not, or clearly or not? As soon as we finalize this audio and video, we'll start the session. And this is a very interesting session. It's not about studying anything, but more importantly, how to study things. And I always believe that when you understand how to study things, it really becomes very, very simplified. Now, this session will be guiding you into how to, uh, cover the all subjects of second year, not only in a way that can be easy for you, but also in a conceptual way. Because reason being, as you all understand that right from the second year itself, if you are quite oriented, it will really help you a lot in understanding medicine, surgery, gynae, obs, and pediatrics. Um, it is often said that initially when the second year was of 1.5 years, you could have covered second year also and a bit of third year also. But now the second year being of only 1 year, and yes, the COVID has really changed a lot of things now. At least you can cover pathology, microbiology, and pharmacology is really, really more than enough. So this session, I tell you again, this session is all about telling you what are the facts and the topics that you must uh, read again and again before you attend for a prof exam, and how to cover those will be talked about by your senior. I have invited one of your senior also to talk on that. She is a topper from LHMC. Her name is Surbhi, and we'll talk about that again after half an hour. But initially, we'll talk about what are the topics to be covered, how to read them, and what to read about them. Um, I will want all of you to put all of your comments, thoughts, doubts in the live session here, because also I'm live, so I can understand your queries also. So if you have any queries, any topic, you can let me know. But that this again, I tell you, this is not a teaching topic. This is not entire session is not at all of teaching. It's only about guiding process. So you can ask any doubts regarding to microbiology or pharmacology as well. How to cover this topic because you're finding it very, very difficult, and maybe we can answer it in a better way. Now, before we move there, I have a few things to tell you. I will start with how and what to read in the second prof. Please understand that this whole PDF that I've made is taking into account those topics which have been repeatedly been asked in most of the medical colleges. It's not only about a Delhi Medical College or say a Kolkata Medical College. It is about a college anywhere in India will mostly be covering these topics that I've actually put it here. Because obviously I take pathology, I will not start with pathology here. I'll start with microbiology and I'll start with pharmacology. So usually a textbook for microbiology, a very well-favored book for microbiology is Apurva Shastri, and really he's a very good writer. Let's all be agree, we should all agree to that fact. If you look at the textbooks of microbiology, you can definitely cover it from the Anant Narayan Panikar, and you can also look into the textbooks of parasitology, Chatterjee also. Now, guys, let's understand how to cover this. Now, most of you, if you are a DBMCI student, you might be studying it from Nasir sir, and really students have really loved him a lot. Now, when you watch a video, I would ask you all to first understand which are the topics of general microbiology that you must be more and mostly focusing about from the secondary point of view. So yes, this PDF is already shared. I'll share this after this whole session in my own Telegram channel. You can see it from there also. But let's understand what is the basic use and how should you understand this topic coverage. Dekho, uh, the Pasture and the Cox, these are often asked as the short notes to you. So I'm putting these topics and I want you to understand this star mark also. The star mark here means they're very, very important. Okay, very, very important. Especially when you're asking, going for a Viva, you cannot go to Viva without reading about the staining, right? The difference of cell wall of a gram positive and gram negative, the growth curve, what are the different growth stages of a bacteria, they all are very important. How does the log phase come, lag phase, lag phase, log phase, and the stationary phase, they are really, really very important. Sterilization method. Tell me one Viva which you have faced in your second year which is not covering the sterilization topic. This is really, really again very important. So you should understand all the sterilization methods, their examples, along with the biomedical waste management. This is very, very important. Culture method, Viva is very important. The method means what lawn culture method or streaking culture method. These are again are very, very important. Bacterial identification is important for viva usually. Steps of PCR, the 3 steps, as you all know. How do you first, first separate the denaturate the DNA, you then align the DNA with the help of the primers. That is the step of annealing, and then you actually cause the and then when you decrease the temperature, again there is extension phase. So all those phases with the temperature is very, very important for the PCR, and it should be read and understood. The plasmid transduction, conjugation, transformation is again very, very important topic for you all. And mutation versus transformation, this is a very, very important topic for the second year person. Exotoxin and endotoxin differences, it has been really been asked in for you in your difference. Often I have seen the second year paper often have the differences apart from AIMS question paper, which usually has only and only MCQs and don't have this short notes and long notes at all. Lab diagnosis of the systemic pathology, systemic microbiology, Staph aureus, and then the pneumococcus. The Corynebacterium is very, very important. It has been repeatedly been asked to you, and understand that the anthrax toxin, even though anthraxis is not very commonly happening nowadays in clinical scenario, but this is very, very commonly asked for you. Mycobacteria, everything is important. Do not ignore this chapter of mycobacteria. I can tell you this is very, very important. Okay, so mycobacteria, may read about the tuberculosis. So when you read about the tuberculosis, ensure that you read the pathology point of view, also the microbiological point of view. Now this will make the entire topic complete. Believe me, this is also enough to read the medicine in the mycobacteria. Leprosy again is very, very important. So try to read leprosy also, even though I know understand that many of the students will ignore leprosy when they move to the 2 types of leprosy, the lepromatous leprosy and the tubercular leprosy. They often just tend to understand TK leprosy, oh no, leprosy, let's not do the details of this, and that is when the confusion starts. So I would ask you all to watch the difference table. I have ensured I have also covered this in my own lectures in my e-Gurukul, and watch the difference of the leprosy, 2 types of leprosy. I have covered this in the infectious disease topic. Okay, then about the Vibrio cholerae lab diagnosis is very, very important, along with Haemophilus and the Legionella. These are really, really important. At least you should know the Legionella is more common in the air conditioned infections, and that is very, very important. Okay. In spirochetes, syphilis, the stages of syphilis, the 4 stages of syphilis, the primary, secondary, tertiary, and the quaternary syphilis is not very commonly now occurring nowadays. So primary, secondary, and tertiary syphilis. Leptospira, rickettsial table, all the types of rickettsia, the diagnosis of rickettsia, I hope you remember OK2, OKX, and OK. These are very, very important. Chlamydia table again is very important for you. In virology, the virus isolation, this again is a very important topic. The different method of virus isolations, they are often asked. In herpes, the EBV and CMV, I will just say that these 3 viruses are enough for you to read. And always start the virus reading first with a classification. Do not just jump to the virus. Like, you cannot understand the Epstein virus unless you have not understood the classification and structure of these viruses. So first understand and remember how to understand the differences of the classification of the viruses. Only then you read these viruses. Smallpox, I will not say it's very, very important, so I have not put very multiple stars there. Bacteriophage, this is very, very important. Okay, the bacteriophage importance in biotechnology is also very important, and they have been asked repeatedly as a short note. So ensure that you also read bacteriophage and its importance. Influenza, obviously you cannot ignore influenza, especially with the COVID scenario coming up. Influenza types and the para-influenza, you should know about the genetic drift and swift differences. They again are very frequently asked, and about the MMR vaccines. About this OPV and the IPV differences, this is a very classical question to be asked in your Prof exams. So ensure that you read this. Arbovirus table and dengue. Dengue may, especially if you are staying around the North Indian region, dengue will be an important question. Understand the pathophysiology and the stages of dengue infection. This is very, very important. Okay. Rabies virus infection. Try to understand the rabies virus and the vaccine strategies. Even though rabies will be taught again in the PSM in the next year, but I would suggest you to read rabies vaccination strategies in the microbiological point of view also. HIV is really one topic which you must read. Okay, HIV pathology is not as important as HIV from the microbiological point of view. In HIV, try to understand the structure of HIV, try to understand the pathophysiology of HIV. This is very, very important. Okay. The NACO strategy of controlling the HIV, it keeps on changing, and I'm very sure that you might have read this from somewhere or the other. We'll try to understand this and try to remember this. Okay. Coronavirus, even though it is, it has not been included in most of the textbooks, but you all know a lot about this COVID infections, and COVID infection, what is happening is the ARDS, and that is what you must remember. Hep B and Hep C, you can read this from pathology or the pathology and the microbiology as well. Anything is good enough. But Hep B and Hep C, the stages and the pathophysiology is very, very important. Understand the difference of these two viruses, and the serological point of view is very important, guys. Do not ignore the serology of Hep B and the Hep C. Okay. Yes. Oncogenic viruses list, EBV, HPV mechanism. These again are very, very important. So try to again revise this as much as you can. Mycology may, if you go to the mycology point of view, then the lab diagnosis of fungal infections, all those ways of taking the the sampling of fungal infections, and how do you do first of the KOH study, then what do you do with the lactophenol cotton blue staining, and then what you do with the culture methods SDA, which is incubated at the room temperature as well as 30 degrees Celsius. These are very, very important. Okay, the importance of KOH is very frequently asked. To understand the importance of KOH, they are asked as a short note, or a long question can also be given to that. Mycetoma, the types of mycetoma, systemic mycosis, crypto and candida, these are very important. Understand the structure of these are important questions in the questions there. Aspergillus, this again has been repeatedly been asked question. Aspergillus has again gained more and more importance because of the COVID infections. You understand the yellow fungus, black fungus was very frequently asked. Yellow fungus being Aspergillus and the black fungus being Mucor and Rhizopus. Now the NSI, I hope you understand what is NSI, the nail stick injuries. How does nail stick injury can occur? What are the chances of getting infected with HIV and the hepatitis virus with this? And how to control this again becomes very important. The biomedical waste management is one other thing that you must all know there, along with the water surveillance. In syndromic microbiology, it is very important to understand that the long question of the second year is often asked, starting with meningitis. That is often you'll see, sorry, very sorry, that the long question is often framed in a case-based scenario. For example, a 15-year-old girl came to your OPD with or emergency department with fever, rigor, and she has neck rigidity. The moment you get neck rigidity, you move into meningitis. Now, this is a clinical scenario given to you. Then the question is, what are the investigations to be performed? And you always start with the CSF and the blood culture. What are the lab media, culture media in which you'll put it? So if it is CSF, you have to put in blood agar, you have to put in the chocolate agar. And then you have to draw those diagrams of the meningitis infections, because pneumonia, and you have to understand and make the examiner understand that you know enough how to identify this in the next step forward. So when you get these questions, always try to make a flow diagram and just don't be in a paragraph way. Yes, you write paragraph is a very good thing to fill up the pages, because that is the first thing that a student should do in the secondary exam, to fill up the pages. But what is also important, to let the examiner know that you know it, and the best way to let him know is to make the flow diagram. That is very, very important. Okay, now respiratory tract infections has been repeatedly been asked question. Infective endocarditis as a long question has been asked in a clinical scenario. Diarrhea, UTI, and STDs are again very important. In STDs, there's a table. Often, if you remember this in a table, what are the pathogenic organisms? What are the main symptoms to that? And in one line, you should know the treatment. If you are read it from pharmacology, it's well and good. Obviously, in microbiology textbooks, also the treatment is given in one of that. Okay, now apart from this, in parasitology, so this is again a very important thing that often students miss in the second year exams. So in parasitology, I would request you all to go through entamoeba and amoebiasis. Amoebiasis, may try to remember the two types of amoebiasis and how are they different in the pathophysiology point of view, as the PAM and GA. Giardia is important both from the practical aspect point of view. The trophozoites of Giardia, the Kala-Azar, the lab diagnosis of Kala-Azar, the pathophysiology of Kala-Azar, anything is important. And this Kala-Azar becomes more important if you're staying in the north of our country or in the eastern part of our country, especially if you're watching it from Bihar or Orissa or from West Bengal, or entirely the northeastern states, north states and the northeastern states as well. Toxoplasmosis, cryptosporidiasis again becomes very important. Tinea, this is one question which will always trouble you. Now, I would request you, when you read tinea, please read also to how to identify the eggs of these infections. Eggs of Ascariasis, eggs of tinea, they are and will always be an important question in any of the exam. Okay, Hereditary cyst is again a very important question. Entropius, hookworm, and ascariasis are an important point of question that you should be reading. Pilosis lamellidinosus is again very important. Especially, you should read about when to take a smear, how to see the smear, and the differences of the two types of filareal infection, ankylostoma, how to differentiate them, which is a Bancroftي, and the Brugia malai. They are very practical questions that is often asked. Okay. Today's leishmaniasis and the concentration techniques are again very, very important. Now, this is important from the practical and the viva point of view. So you should read about the concentration techniques therefore also. Okay. Now, this was all about the microbiology. So what I'm trying to do it here is I'm trying to make a small list. I'm just trying to make a small list. This list is in my Telegram group. You can all just watch and you can download it from there. This list is all about how to and what to read from in second year. If you are in second year and not read everything and you just want now to get into basic things, or supposedly you have read everything, now you want me to tell what is important, you should and go through this list. Okay. Now let's move to the pharmacology. In pharmacology, as you all understand, general pharmacology always and always will be important. So try to first remember the basic concepts and the roots of the drugs that should be given. The concept and definition of bioavailability is very, very important. Biotransformation and the MIC inductions, they have a table also, and try to remember at least with 2 examples of them. About the books, I will talk about the books in the later half of my session. I am first going to the basic concepts and the thing that you should read. I'll talk about every book that is important, and it's better that you listen that from your own senior, which I've also invited in today's session. The Plato, synergism and antagonism, these are very, very important. Antagonism and synergism differences. Then the factors affecting drug action, rational pressure, and the pharmacovigilance again are very, very important. Let's go to the topic by topic. The books is often Kiriti and Katzens are the best book in pharmacology. You all know this. But if you have a small, we call this chotha or we call this notebook in our own medical college often circulating there, it's a good way to read that, revise that. But the basic concept you'll get only when you read good books like Kiriti and the Katja. In the endocrinology, the thyroid drugs, anti-thyroid drugs, insulin again is very, very important. You cannot go to the exam without reading the types of insulin, their mechanism of actions, and what doses are not very important. Tell me, one thing is very, very important to understand: the doses are not important in second year. Please, so don't go after doses. Only go through the mechanism of actions, go through the side effects, and the route of administration in the drugs. OCPs again is a long question, as you all understand. Steroid uses, oxytocin, and the pills are again very, very important. In the neurological pharmacology, muscle relaxants is very important. Try to remember the differences of the local anesthetics, especially lidocaine, bupivacaine, and the types of LA also, along with spinal anesthesia, and especially the complications that can arise with the spinal anesthesias. In general anesthesia, try to read the basic ketamine, fluorine, and the propofol. These are again frequently asked. The side effects again are very important, so don't ignore that. Again, repeat, doses are not very important, so you can ignore that doses. You can definitely ignore the doses. Then the benzodiazepine, valproate, phenytoin, side effects are again important. Okay, antipsychotics are very important along with the Parkinson disease questions. They are very frequently asked. Okay, antipsychotic side effects along with lithium, especially this lithium is one drug which is always going to be asked in the short notes. Okay, anti-anxiety, antidepressants are again very important. Along with that, SSRI and TCA are one thing which should be read. Okay. In opioids are very important along with the RAS drugs, angina, this and hypertensive drugs. These are one question. MI, these are one question. This is very, very important. Long question will be asked from antihypertensive, angina drugs, MI, or the heart failure. Now, this point number 13 is a long question in whichever exam you are appearing for. So try to go through this. Okay. Amiodarone, lidocaine are again very important. Okay, antiplatelets, anticoagulants are often asked as short notes. They're not asked as long questions, but I've seen somewhere the questions are asked on the mechanism of action of every antibiotic drugs, which becomes very, very important. Lipid lowering drugs are one thing which is importantly to understand, and you must remember that. Okay, and antiemetics and ORS, you all know that should be read. In the anti-cancer drugs, try to read about the methotrexate, their toxicity, and the acne. Try to read about the disinfections and the other vitamins that is there. Rabies infection, MMR, polio can be read from the microbiology also. But try to remember that these things are really, really important, especially the general pharmacology, endocrinology, ANS, and the neurology. So I just didn't talk about the ANS. Let's talk about the ANS now. Now, in mushroom and the pilocarpine, they are very, very important. Try to read the classification of the acetylcholinesterase and the poisoning there. Anticholinergic drugs, these are again very important. Adrenergic classifications, anti-adrenergic drugs and the usage. Again, I repeat, don't go after the doses. Try to read the basic examples, classifications, and the mechanism action. That's really, really more than sufficient. Glaucoma drugs and migraine drugs are a long question, so you cannot ignore this. Anyhow, ALS is one topic which everyone loves to read, isn't it? Now, this is very, very interesting also, and students really find it very, very hot favorite. They always started reading this from the initial chapter and topic as well. Prostaglandin analogs, antihistaminics, migraine drugs, they are very important. NSAIDs are one topic which can be asked as a long question also. Now, this is RA drugs and the gout drugs, especially the RA is very important. It could be asked as a short note or could be asked as just the naming of the drugs in the viva as well. And the cough and the treatment of asthma is again very, very important. So guys, these are the basic topics that should be read in microbiology and the pharmacology. And I really hope that you would have found this list very, very crisply made. It was made by some of my students last year and who are from MAMC. And this list will be available in my Telegram group just after the session, and you can download it from there as well. Now, before I move forward to pathology again, I would just request one of your seniors to join the session and let us know how to actually cover these topics in a best way, how to write the exam paper, how to revise the stuff that I've already read, and more importantly, how to get good marks. Now, I'm telling you, I will just invite Surbhi. Surbhi was my student last year, and she not only scored distinction in most of the subjects of second year, but has been so much meticulous in reading and revising stuffs that when you talk to her, when you listen to her, you'll really feel that, yes, I must be like this only. So I just request Surbhi to join us. Yes, Surbhi, you are surely audible. I would be just not be visible in this video. So I'm just hiding myself.
You are not audible, I guess.
Yeah, Surbhi, you are completely audible and please go ahead.
Okay, so hello guys. I am Surbi, 2018 batch from NHMP. And I just want to tell you that how you should write your answers in the Prof exam. Let's start with the pathology. If like any question gets bombarded to you in pathology exam, firstly you need to answer each and every question under 5 headings. Like first heading should be the etiology, etiopathogenesis, and the second, like in etiology, you should like if there is a malignancy, you should mention the risk factors, and if there is like any other condition, you need to know the etiological factors, right? And in the second heading, you should write the pathogenesis. I suggest it should be in a kind of a flowchart manner. So you try to be very like concise and very write the answer in a summarized manner. I don't know why people say like you need to fill the pages to get the number. What I feel is that you should just summarize your knowledge and just like be concise as much as you can, because examiners will also not want to read the information again and again, right? So the second heading should be your pathology, which should be in kind of a flowchart manner. And the third heading should be the clinical features. So if you write the clinical features, it will give an idea to the examiner that how you have a clinical like knowledge, like how the patient will like come to you in the OPD, the way you will suspect and all. So your third heading should be the clinical features. Now, in the fourth heading, you should write the macroscopic features, and in the fifth heading you should write the microscopic features. Like in microscopic features, you should always try to make a diagram with H and M E. But yeah, I know maybe it will be quite lengthy exam. So even if you make a schematic diagram, no, that you know like what you know in the microscopy and all, so it would be sufficient. So every answer in the pathology should be concise in under these five headings: etiology, pathogenesis, clinical features, macroscopy, and macroscopy. I mean the gross thing, right? Uh,
Sorry, please go
am
ahead.
I
Sorry, very
audible?
sorry. Please go ahead. Please go ahead. Sorry. Sorry, please go ahead. Sorry for that mistake.
No, sir. Yeah. So I this is the thing. Like in this way, you should write a pathology answer. The gross thing, not for every specimen you should know the gross, but it will be nice. Like if we have recently now discussed the questions that are expected to be in the Prof. So try to know the gross for those things, right? Now let's come to the pharmacology. Like in pharmacology, now there are quite different type of questions. Like first question is why, what are the reasons, why type of question. In these questions, it carries just 2 marks. You just need to be as precise as you can. Just give the reason, like why these drugs are being used in this condition, or why these are contraindicated, like why kind of a question. And these are the math scoring questions, because if you write the main reasons now, that like what has been asked in the question, even you can even underline, like you need to be concise. Like please don't think that you need to fill up the pages and then you end up not completing the exam. You just need to show that okay, you know everything, and you just depict the knowledge in a very summarized, in a concise manner. So why kind of a question. Then there's a second kind of a question in which you have to say therapeutic status of a drug. I don't know why, but people find it difficult to write this kind of a question in the therapeutic status. See, you will be given a drug and in a condition, what's the status of beta blockers in congestive heart failure, right? So firstly, you have to mention the drugs that can be used, other drugs other than beta blockers that can be used in the CHF, right? So mention those drugs, and then you need to compare the beta blockers with those other drugs that you have mentioned above. In short, examiner wants to know that whether you know, see, for a condition to treat, there are number of drugs that are available. But we should know now, what are the first line drugs, what are the second line drugs, and why they are first line, whether their efficacy is more, right, either their cost is less, their potency and all. So you should know that in all these options that you have in your drug list, which is to be used first and then to be used second and all. So firstly, write the drugs, other drugs that are available for the condition. Then the drug that has been asked need to be compared with that drug. And how you'll compare that? You will compare, like, say beta blockers has advantage over this for that drug, and even the disadvantage. If it has beta blocker has side effects, then you have to write the side effects, and then conclude the answer ki beta blockers are first line or second line, are either contraindicated. You have to go in that way. So this is how you will answer your therapeutic status wala question, right? So the other question is treatment of a condition. See, these questions are very less, and a very less number of questions need to be prepared for this. Like they are classical conditions, like disease status asthmaticus, status epilepticus का treatment बता दो, diabetic ketoacidosis, thyrotoxicosis. Like these are some classical questions for which you will be asked the treatment. For this, you need to be very much, particular about what line, like what treatment we give. Like even the conservative treatment, like in diabetic ketoacidosis, even if we use IV fluids or not, whether we give potassium chloride or not, why we give potassium chloride. Like we need to know each and every option, like each and everything that is being used to treat that condition. So this type of question is difficult to answer according to the pharmacology, like information that we have in our KDT. So you can find it in the medicine book easily, and these are very less questions. So uh, you can read that from the medicine book. but you have to, if they are asking you the treatment for a particular condition, mainly the emergency conditions ना, तो you need to be कि firstly हम ये देंगे, secondly हम जैसे ऑक्सीजन भी दे, like MI का पेशेंट आता है तो like what we need to do, firstly हम एस्पिरिन देंगे, ऑक्सीजन देंगे, क्या क्या किस किस like कब देंगे, you need to be know the sequence, right? In another question that come in the pharmacology is key short note on a drug. So when you have to write the short note on a particular drug, firstly you should know the like in which class that drug falls. Okay? Like I feel the classification should be read na. I don't think, I guess it's so underestimated that classification should be ignored or not. Like classification is the summarized manner, like what you wanna read in this chapter, or like it's kind of a summary, like what are the drugs that you need to know, right? तो क्लासिफिकेशन पता होनी चाहिए, एंड इफ यू इवन राइट ना कि किस क्लास में फॉल करते, इट गिव्स अ गुड इंप्रेशन लाइक ओवर एग्जामिनर्स, राइट? So firstly you should write the class, and secondly you should write the mechanism of action, and thirdly you should write the uses, like what are the indications of that drug, like what, where and where like we can use that drug, and in the fourth heading you should write the side effects, and in the fifth heading, if you know any kind of a special features about that drug, or but you need to mention these four headings. Like you can't compromise over the side effects, you can't compromise over the indication, you can't even compromise over the contraindications. And yeah, that's it. I guess these are the questions that are asked in the pharmacology. So let's come to now microbiology. In microbiology, most of the microorganisms पे short note आते हैं, right? तो हम उसको हम ऐसे लिखेंगे, पहले हम उस ऑर्गेनिज्म का वायरुलेंस फैक्टर्स लिखेंगे. First heading should always be the virulence factor. Like firstly give the intro, obviously that it's a gram positive or a gram negative, like bacilli, cocci, whatever. Like whatever you want to give the intro, just 1-2 line give an intro, and then mention the virulence factors, and then write the clinical spectrum. Please, please, please don't miss this clinical spectrum. It will help you even in the future. Like obviously, you will be dealing with the patients, right? So you should know na ki what clinical spectrum the patient will be with, what clinical things like patient will be coming. Like when will you suspect that thing na? So you should know the clinical spectrum of that organism, like microorganism. And then on the third thing, you should write laboratory diagnosis, which is the most important. And many times they just ask the laboratory diagnosis. They don't even like not even interested in knowing virulence factors and all. Like if they ask directly the laboratory diagnosis, you can skip that part. But if they ask you na like short note on mycobacterium TB, then you need to write these things like introduction, virulence factors, clinical spectrum, and then laboratory diagnosis. Laboratory diagnosis, I'll suggest that you should see in the Purva Shastri. It is give like for every organism, laboratory diagnosis is given in a tabular manner, in a summarized way, and it should also go in a particular sequence. Like firstly we'll do microscopy, then we'll do culture, then we'll do certain like biochemical tests to identify the that organism, and there are certain specific tests for that organism. So you should mention that. In microbiology, I guess this is the only kind of a there are certain topics that are mentioned at the end of the book, right? Like एक तो होता है कि water, like how to test the water purity, like what are the organisms that are found in that. Don't miss that. And even there are like certain, even like infective endocarditis, like these, they give you a disease, and then you should know the disease, like what are the organisms that cause that disease, and how to stepwise approach in the laboratory to guess what gonna be the organism and all. This is given in the Anant Narayan in a tabular form at the end. Na? I think your books have been changed from like new edition has been changed. I don't know, my juniors were saying, but in my edition of a book, in Anant Narayan at the end of the book, there is like every disease, how to approach it in a like stepwise manner that has been mentioned in Anant Narayan tabular manner in a very good way. So you can read that. Microbiology, I think that's the only. In parasitology, you should read Anant Narayan. Sorry, Panikar. Like in parasitology, where you have to write the answer. Like you firstly give a brief intro. Like वो क्या है, नेमाटोड है, ट्रेमाटोड है, अमीबा है, क्या है. Then तो आपको लाइफ साइकिल लिखना है. Life cycle, draw the life cycle, and please don't waste your time if you have drawn that life cycle and then you write in a theory like in words, that doesn't make any sense to repeat the same thing. It will just waste your time, right? Make a very nice diagram of the life cycle and then write the laboratory diagnosis and the clinical features too, right? Don't miss clinical features. The fourth heading should be the laboratory diagnosis. In the laboratory diagnosis, often we have to mention the stool examination. So in the stool examination, try to make diagram of an egg. Like there are very specific questions that are asked in Prof. So just practice to make the diagram of your eggs. You should know the characteristic of the egg, because when you mention the stool examination, so how you gonna identify? You should know, right? So if you even make the diagram now, it will give a good impression. And write the characteristics of the egg, whether it's bile stained or not, whether it floats on a saline solution or not. And yeah, pretty much that's it. I know it will be kind of difficult. Microbiology, like to remember all this, it's gonna be difficult. But try to make na notes like कौन कौन से एग्स हैं जो बाइल स्टेन्ड है, मेमोराइज देम एज अ न्यूमोनिक. कौन कौन से एग्स हैं जो फ्लोट करते हैं, मेमोराइज देम. लाइक किन किन का जो इन्फेक्टिव स्टेज है वो फिलियरी फॉर्म है, या फिर किन किन का रैप्टी फॉर्म. लाइक ट्राई टू कोरिलेट द थिंग्स एंड लाइक डोंट गो इन अ वेग मैनर कि हाँ आप सब याद कर लोगे एक पर्टिकुलर पॉइंट. जस्ट कोरिलेट द थिंग्स एंड मेक नोट्स, राइट? Like I guess that's it. Like how you should answer the questions in the prof.
Survi, so I have a few questions from student side. I'll just ask you. One of those was ki how to revise the textbooks that I've already read, and what is the importance of videos and how to make the best use of that.
Um, so like see the videos will give you right the concise manner ki like what you're gonna read. It's kind of a summary. Like it's very difficult if you in a very first go you will pick up the Robin, and I don't think so you're gonna be understanding that. Or in a very first go if you're gonna pick up KDT and you will be like literally you will not even remember anything. It's like first you see the video, you get an idea, and you learn the things in a very simple manner, right? Like your teachers have made the video in a like I have done my pathology from Praveen sir, and even like pharmacology, microbiology from this Bhartiya only. So firstly, what was my approach? I have seen the video and I have made the notes of it. See, don't think that you'll have like no e-notes. I know everyone has an iPad or no PDF and it will work. I don't think so. It work in that manner. You should have your handwritten notes, right? Because now I think photogenic memory is literally there. Because now, like I have revised my notes at least 2-3 times, and even if I don't remember now sometimes, but I remember ki where that I have written in my notes, and sometimes it clicks. So and I don't know, but I can't go with the It's like until and unless you don't flip the pages now, it don't like I don't think so. I think it will be better memorized if you have the handwritten notes. So watch videos, make a handwritten notes, and then pick up the book now, like standard book, like whatever you want to read. For pathology, I guess you should definitely read Robin, but before that, see Sir's videos, because otherwise you're not gonna understand and you can't even handle that much information. But once you see the videos now of pathology, तो एक तो आपको ये पता चलता है कि what are the things that we need to focus upon, like then सब कुछ नहीं होता ना पढ़ना. So like sir will tell you what topics are to be read and what are the things that you need to focus. And after seeing the video, when you read the textbook now, the things that have been told in the video, it get revised again. Like it will be a second time you will be knowing the facts again, right? So it gets re-emphasized. So and if you and don't think that only videos will like sufficient. I feel you should definitely read textbooks, but obviously I guess now your profs are coming, so don't start afresh from the textbook right now. I'll tell you the books if you haven't read the standard textbooks throughout the year, but for further years, like in the third year, in the fourth year, during the year, like whichever prof you are going through, you should read textbooks. It will give you, if it will widen your view, and it will help you to correlate the things better. Like standard books shouldn't be omitted. Like they should be at least one reading. I know people think it won't be memorized. You should at least give one reading, because in conceptual manner में you learn things, right? You need not to ratify things. So I feel you should in the second year you should have read Robin and Kazung. I know, but I haven't read Kazung. I have read KDT. And in microbiology, you should read Apurva Shastri, and for parasitology, Panikar. So if you have already given a reading for these textbooks, you need to underline the things that are important, and then now revise it. But as I have mentioned, the headings under which you need to write the answers in your profs. So now try to revise the things under that heading only. Like I have mentioned in pathology, right? Like firstly you have to see the etiology, then you have to see the pathogenesis. So just see like, it's like fatty liver. So what are the etiological factors? So मैं क्या क्या लिखूंगी, like what are the things की, what are the causes of that? Then अच्छा ठीक है, pathogenesis है, तो मैं क्या क्या, like now revise the textbook as per these headings only, because now in the prof you will memorize that in that manner only, and it's always nice to write the questions in headings only. So now if you have to revise the textbook, you should always revise the way you're gonna write in your exam. डोंट गो इन अ वेग मैनर कि हाँ एक एक लाइन पढ़ रहे हैं और कुछ पता नहीं चल रहा है, कुछ याद नहीं हो रहा है. हेडिंग्स के बेसिस पे आपको टेक्स्ट बुक्स रिवाइज करनी है. और बट उससे पहले टेक्स्ट बुक उठाने से पहले आप वीडियो देखनी है, और अगर वीडियो ऑलरेडी देखी हुई है तो गो थ्रू द नोट्स. यू हैव टू गो थ्रू द नोट्स. वीडियो बार बार लाइक एक बार देख ली ठीक है, बट उसके बाद उसके नोट्स बनाओ. लाइक बार बार वीडियो देखना, आई डोंट थिंक सो इट्स बेनिफिशियल. मेक अ नोट, like see a video once and make your handwritten notes, then go through the notes again and again.
I think that's a very good approach, Surbi. Well said. Kiki, honestly speaking, it's very difficult for someone to watch these videos again and again. It will take a lot of time. So make your handwritten notes and definitely read the textbooks. Textbooks should never be omitted. As a video or anything else will only make your work simpler. And simplicity is one thing which will help you to remember for a long time. I'll just ask you two more questions, Surbi, before I let you go. One is how to prepare for practical exams, ma'am.
Okay. So like for the practical exams, like see, for the pathology there are number of stations that you have to go through. There is a hematology. In hematology you have to perform, I don't think so in the COVID time you'll get the like you have to perform or what, but it's going in a like manner, it's like you have to perform a hematology experiment, and there is a viva of that hematology, and there is also a case. So guys, just don't miss that leukemia, like the 4 leukemia, like AML, ALL, CML, CLL. Go through that in a very appropriate manner, and even through the slides. You see, they'll project they'll project microscopic pictures like slides, and you have to diagnose what is this. See, if you revise the things that I have said na, in the in the headings that I have mentioned, in that it already include microscopy. So you should already know कि हाँ वो microscopy में कैसा दिखेगा. And moreover na, they project very classical cases of na, like slides बहुत classical होती हैं. Like you know, वे इतना classical कि वो बोल रहे होते कि like पहचानो मुझे types, like इतना ज़्यादा classical होता है. So you should know the microscopy obviously, so it's very easy to identify the slides. So you will not like find much difficulty. Hematology वाली जो होती हैं वो आपने physiology में perform किए ही होते हैं, so it's nothing new. And then come the gross. हर कॉलेज के अपने ग्रॉस होते हैं. इन एलएचएमसी तो हमारे पास तो देयर वाज द पीडीएफ जिसमें सब ग्रॉस होते थे.
Believe me,
And
Surbi, every college has a PDF and every student has that. उसको से अगर पढ़ना होता है और वो क्वेश्चंस तो उसमें से आते हैं, सेम एग्जैक्टली सेम थिंग आर आस्क्ड अगेन एंड अगेन. So it's better that you always look at the PDF before the practical exam. So practical exam and theory exam often have that gap of around 10-15 days, and that's the best time to read those. But about this microbiology, eggs are very difficult to identify. एक बात बताओ कि कैसे रटा था इस egg अंडे वंडे को?
So see, in the Panikkar na, like her egg ka, they have given the features, identifying features. So like I have already mentioned कि जैसे ना 3-4-5 features होते हैं egg के. एक तो shape, like what is the shape है ना, of the like कि like different shapes होती हैं. And then फिर उसके बाद कि whether it's bile stained or not, and whether like whether it floats or not, like or there are certain specific features जैसे 6 hooks in the oncosphere and all. See, I will feel कि ना eggs का you should not make notes in a separate like copy and go through it like almost every day. Like and now when you draw the egg, it will retain for a very long time. So I think you should always practice to how to draw it. Though I know it's just a circle, you right? It's not difficult how to make a circle, but it's gonna retain for a longer time if you have drawn that egg. And try to correlate the egg with the life cycle. Because किसी egg में आपको repetitive form larva दिखाना है, किसी में आपको वो hooks दिखाने, किसी में आपको spores दिखाने हैं. Like you should know that ना कि उसमें क्या दिखेगा. तो आई फील कि एक तो एग्स के अलग से नोट्स बनाओ आप और कोरिलेट करो कि अच्छा ठीक है तीन ऑर्गेनिजम्स थे जिनके बाइल स्टेट थे. अच्छा ठीक है 4 ऑर्गेनिजम्स थे ये जो लाइक फ्लोट कर रहे थे. एंड जस्ट गो थ्रू इट लाइक दैट. That's the only thing like which will help you.
I don't think pharmacology will have that importance of practicals, but Viva are important. Just one more thing.
So Viva सारा theory से ही आता है. Like if you know the theory well, typical theory is asked in the Viva.
Tell me one thing, Survi, how to remember the long classifications, especially of the antimicrobials. Those really are very confusing. It's cephalosporin generations and all. So how did you remember this actually?
So like frankly speaking, I have never ever like memorized that cephalosporin वाला classification. मेरे को कभी अच्छे से याद नहीं है. It's just कि एग्जाम से एक रात there are certain topics जो आपको एग्जाम के एक रात पहले पढ़ने होते हैं भाई. Like उनमें से एक होता है ये cephalosporin का classification. Just marked it up. Like and you don't have to know each and every drug like उसका कि उस classification में हर drug like 6 generations या 5 generation whatever the number is, and just दो drugs हर के याद कर लो. cephalosporin classification is tough, but mind it जो बाकी जो classifications है ना that which are based on the mechanism of action that are quite informative, and that will help you in like remembering the things. And वो mechanism of action वाला classification तो आना ही चाहिए. And it's quite easy, it's very conceptual कि like it's kind of a flow chart कि how you gonna proceed in the chapter, or how like what are the kind of like drugs that are available in that particular group. So classification तो it's like you need to learn like उसको लिख के देख लो या बार पढ़ लो. But classification से mostly classification mechanism of action वाली होती है और मेरे को मतलब जितना याद आ रहा है. और एक दो क्लासिफिकेशन भी होती हैं जो आपको पेपर से एक दो घंटे पहले पढ़ो और जस्ट वॉमिट इट आउट। बट हाँ, एंटी फंगल क्लासिफिकेशन मिस नहीं करना है, एंटी मलेरियल्स मिस नहीं करना। आई नो दीज आर एंटी माइक्रोबियल बहुत बड़ा चैप्टर हो जाता है एंड एंड तक आते आती हुआ कि बस हो गया, नहीं। एंटी मलेरियल्स की क्लास पता होना चाहिए, एंड एंटी फंगल वही मैकेनिज्म ऑफ एक्शन पे बेस्ड है, दैट लाइक व्हाट ड्रग्स आर लाइक एक्ट ऑन अ सेल वॉल, कौन से पॉक्सीडेज पे काम करते हैं, एर्गेस्ट्रॉल पे काम करते हैं, लाइक इट्स ऑल अबाउट मैकेनिज्म ऑफ एक्शन। तो आई डोंट थिंक सो यू विल फेस डिफिकल्टी इन लर्निंग द क्लासिफिकेशन दैट इज बेस्ड ऑन अ मैकेनिज्म ऑफ एक्शन। बट या एक तो एंटी एपिलेप्टिक ड्रग्स का होता है, उसका भी मैकेनिज्म ऑफ एक्शन भी होता है। इट्स जस्ट सम ऑफ द क्लासिफिकेशन एंड जस्ट I guess mugged it up and just vomited out.
Okay, so okay, thank you, Survi, for giving your valuable time. And first of all, in a short notice, because you were available for me, it really makes my day. Thank you very much.
It's my pleasure. Yeah.
Okay.
I hope like I would have been like
No,
given
you
the
were
valuable
more than
information
helpful.
to
You're more than helpful. Believe me, um the way that you could explain everything, how to approach microbiology, pharmacology, and pathology as well. No, my work is almost done. So thanks a lot, Survi.
you. Thank you, sir.
Okay, so coming back to the topics that now I need to just cover. Now, believe me, my work is almost done because of well explained facts by Surbi. And now I'll move back to the last topic, that is actually the uh, pathology here. Before we move forward, you may just put on any questions that you have, and let's again move forward by putting into what are the important points that you must remember here. Dekho, in general path, I just listed out every topic that you must read, and this can be in the short note because mostly general pathology questions are on short note only, apart from hypersensitivity disorders, which is a long question, and along with that the septic shock, which often comes as a long question. Amyloid often is not a long question, but yes, examples of amyloid can be asked in a short note as well. The differences are often asked from the first chapter, that is cell injury, the differences of hypertrophy, hyperplasia, or metaplasia, dysplasia. These differences are very frequently asked there. Before we move forward, please do like the video if you really liked it, and do share this among your friends also, so that they can also get benefited from the same as well. Those who are in your second year and they want just somehow to let them know what are the topics to be read, and I'm very sure that you will also feel that this 1 hour of session that we actually are doing will really help you to understand a lot of subjects as apart from pathology as well, right? Now, Dekho, in general pathology, the topics are necrosis, apoptosis. They are very frequently asked. Reversible injury, irreversible injury. In this, the question often asked on the types and morphological types of necrosis. They are again very frequently asked. Um, Along with that, there is acute inflammation, which is also having vascular events and the cellular events of inflammation. There's chronic inflammatory pathway, and along with that, the primary and the secondary healing pathway. These are a frequently asked question. Edema is important, even though the pathophysiology of renal edema and the cardiac edema are often asked. But don't be over reading this in the mechanism part of you. So don't go into the medicine part mostly. Uh, Medicine part as well. So I would request you just to focus on the basic mechanisms of edema, and don't go into the medicine point. I have seen students reading a lot of Harrison's here, but I don't think there's any requirement to do that. Along with that, renal and the cardiac edema, septic shock is one topic which is very frequently asked. This is a one topic which is also explained in a chart wise manner by me in the various videos. So go through my video of septic shock. It is really important. Hypovolemic shock, similarly, the types of embolisms, these are important. Fate of thrombus, a very simple mnemonic I talk about in my class. It is dope. Try to read that. Varicose triad is just important for the for the viva questions. Now, hypersensitivity reactions along with the examples, this is a long question, short note, a viva question, whatever can come, MCQ, anything that can be asked on this topic, because this is a hot favorite for any examiner worldwide, not only in India. Okay, amyloid with stains, the stains are not very much, but yes, the finding of stains are frequently asked, so understand and remember this. AIDS, I told you, you can read this from pathology, or you can read it from from microbiology, and anything is same only. You can read anything that you want to. GVSD is one topic along with graft rejection, acute especially. They are very frequently asked. This autoimmune disease is, one thing which can be asked as a long question. Now, I have also made a very special video for you for this in my Gurukul, and if you have some time, you can watch this. It's very, very important and must be remembered. The syndromes in genetics like Turner's, Klinefelter, Downs, I have explained to you this all of them with the help of mnemonics. You will all remember Klinefelter का mnemonic Klinefelter है. Turner का mnemonic is just clowns, and the mnemonic of Downs is problematic situation. I hope you all know this and remember this. If you not, don't worry. Just go to my Telegram group and you will watch. You'll see a very simple notes there. You can just see that in the PDF section, and you can very well get that. Tay-Sachs disease, Gaucher disease are a bit important, but I know that most of you have also read this in the first year biochemistry, so this is okay for that way. Benign and malignant neoplasm is one thing. Carcinoma, sarcoma, differences are just for viva purpose. Paraneoplastic syndrome, it is just one topic that, as Sophie also was saying, that some topics that should be read just before the day of exam. I believe this is one table that should be read before the day of exam. Similarly, with tumor markers, it should be read just before the day of exam. It is important both for viva purpose as well as for the theoretical purpose as well. These two genes are one thing which, if you don't read, you're really not doing the justice to the pathology. So try to read always PIP3 and RB gene. They're very, very frequently asked, and other things are not very important, but yes, you can go through that. In hematology, the big list, and believe me, hematology is not only important for your prof point of view, but is also very important from the main exam, that is the PGME point of view. So don't ignore hematology. Okay, I know it's difficult, but therefore the reason that I always start with hematology as a first topic when I take my lectures. GSPD, HS, thalassemia, sickle cell, PNS, they're very, very important, guys. They can be asked a long question, short note, or can be asked in a theoretical critical base scenario as well. I've often seen the mechanism of iron absorption in the iron deficiency anemia. Similarly, the B12 absorption, that stepwise approach, are very frequently asked. Schilling test is not commonly done nowadays, so don't read and bother reading that. Anyhow, blood component therapy is one thing that you must go through. This is very, very frequently asked and must be remembered. Now, short topics like ESR, Bombay blood draw, PT, APT are important, and try to remember this. These two topics, AML and CML, these are characteristically asked as ever when you see a patient having a 35-45 year age group, he's having fever, bleeding gums, and there is suppose the hepatosplenomegaly, go for AML. Now, if there is a 60-year-old patient who is having just hepatosplenomegaly without a fever history, or there is a bleeding gum history, go with CML. It's a very characteristic question often asked in hematology. Therefore, serial with all prognostic factors. There's a list of prognostic factors. If you remember, there's ZAP70, there is the other LDH marker, and then there is the CD38. These all are the markers that is important as a prognostic marker in CLL. Difference of CML with leukemioid reaction is one short note that you can expect. Multiple myeloma, it is often asked as a lab diagnosis of multiple myeloma. Always start with the CRAB findings, and from that move to the bone marrow aspiration and the biopsy findings as well. Hemophilia, VWD, and the DIC are again very, very important. I'll just say the short notes. DIC can be asked as a long question as well. So just remember the pathophysiology table that we have read multiple times in our lectures. Platelet and coagulation disorders, defects. In the platelet defects, if you can remember, it is grouped into two headings. One is the qualitative defect and one is the quantitative defect. Now moving across, in lungs, we see emphysema, asthma. They are two questions which is always there in any exam. Along with that, pneumoconiosis is one question which will trouble you not only in the prof exams, but is always asked also in the PGMEs. So exactly same questions are also asked in PGMEs. Along with that, stages of the pneumonia. These stages of pneumonia, they are one thing that you must remember. Okay. The pathophysiology of bronchogenic carcinoma, I will suggest that more importantly is the diagnosis of bronchogenic carcinoma. When this question is asked, try to remember the etiology and the classification of the bronchogenic carcinoma. That is really more than sufficient to cover every aspect of the lung cancer there. Go for GIT, the difference of the TB and the typhoid ulcer. The inflammatory bowel disease with Crohn's and ulcerative colitis is very frequently asked. Celiac disease, the notes are important. That is the importance of HLA marker there, that is screening antibodies there, and the pathophysiology diagram that we often draw in our own notes is again important. Adenocarcinoma colon, especially difference of the left and the right adenocarcinoma in terms of clinical features is important, and you should must read that. What is FAP? The APC gene mutations, the syndromes with FAP are Gardner syndrome and Tucker syndrome. They again are frequently asked. In carcinoid, just remember the examples of carcinoid, the foregut carcinoid, midgut carcinoid, and the hindgut carcinoid. These again are very, very important. In pathology, in the serious topic, there is rheumatic heart disease. Atherosclerosis is one topic which is often asked as a long question, so you must remember that, especially rheumatic heart disease and atherosclerosis. The MI is important, okay? Then about the pericarditis examples and the PAN. PAN is a short note. You can just remember the type 3 hypersensitivity findings in PAN, and there's really more than sufficient. In the liver and pancreas, so I was just being asked one question about pancreatitis and cholecystitis. There's a very frequently asked question. Especially read the main pathophysiology of the acute pancreatitis. I've covered this in a detailed manner in my Gurukul notes, and I will just request you all to go to the 20 minutes of video. You'll know everything about the pancreatitis, as well as what you're asking me is cholecystitis. Acute cholecystitis, basically because of gallstones. I've covered this separately for the second students only. Believe me, that's not very important from the PGA point of view. It is only for you that I've covered this in the second year videos as well. Now, acute pancreatitis, chronic pancreatitis, this is very frequently asked. So at least know the pathophysiology of acute pancreatitis. This is in a table form. I've explained to you the lab diagnosis as well. Viral hepatitis may, the serological diagnosis is very, very important. Cirrhosis may, this often asked as a slide also. So try to remember that. One topic of liver, alcoholic liver disease, one topic. Without this, if you're going with the exam hall, you're really not doing justice to yourself as well. So try to remember this one, alcoholic liver disease, very, very important. Okay. Similarly with hepatocellular carcinoma, gallstones and the fatty liver is very important. Okay. In the genitourinary system, prostatic carcinoma and the BPH, especially with the prostatic carcinoma, try to read the Gleason scoring system, how it is done, and what is the importance of Gleason scoring system is very important. Okay. Seminoma is often asked at a short note and is often given a slide in the second exam. I've recorded the entire list of slides for you in my Gurukul videos, as in the practical video you'll find that I have covered almost 45 slides in a one session of 2.5 hour session, and I would request you all to watch my lab practical videos in my Gurukul app. You'll really find it amazingly important and will really be benefited out of it. Teratoma ovary. Teratoma ovary is important. Teratoma of test is also important. Teratoma, you all know, it's very most simplest of the question. As soon as you get teratoma, you simply classify this into benign teratoma, malignant teratoma, and the monospecialized teratoma. That's how you must approach a case of teratoma. Now, see, if you are knowing the histopathology of any slide, it is best that you take a pink color don't take a sketch pen, take a color pencil and draw it there. Take a pink color and the blue color pencil and draw it there, because it will give an impression that you know really lot about it. So don't be shy of drawing that image. Draw it to get more marks, and it really help you, because the examiner knows that you know this question and maybe you don't know 3 or 4. They'll give you a good number of marks, and who knows, it's just 2 or 3 marks will make you from 74 marks to 76 marks, and then you are worthy of calling yourself a topper or worthy of calling yourself a distinction in pathology as well. In kidney, these are the very frequently asked questions, guys. Don't ignore any nephrotic or nephrotic syndrome. They're very important. Try to remember the renal cell carcinoma classifications. The chronic pyelonephritis, especially with the stones, the staghorn calculi is very important. Wilms tumor and the neuroblastoma differences are important. Try to remember that. It is not very important to remember the acute renal failure, basic pathophysiology, but try to remember the classifications of the pre-renal, renal, and the post-renal acute tubular necrosis as well there. Diabetes again is one change which I would suggest that if you're not reading this, you're not doing justice to yourself. So my suggestion is to definitely read and go through the diabetic changes also. In breast, try to read the Paget disease, myofibroadenoma, and the breast carcinoma classification, prognosis. This is one topic that you must read there. Okay, you surely must read there in breast cancer. In bones, these are mostly important for the histopathological point of view. I have seen the gross images asked in medical college on the giant cell tumor and the osteosarcoma, the Codman's triangle, and the microscopy should be remembered for the Ewing sarcoma. Yes, Ewing sarcoma and the osteosarcoma. Microscopy is very important. Osteomyelitis is often asked as a long question, can be asked as a short note also, and it's very interestingly explained in my notes as well as Robin's. in brain, these tumors are important. Among this, try to remember the basic pathophysiology and the histological findings of this astrocytoma, glioblastoma, neuroblastoma, and meningioma. These all are important. Okay, don't go beyond this. Is really more than sufficient. The CSF finding meningitis, CSF finding. This is one topic that you should read. Do not ignore the CSF finding meningitis. It is asked in a short note, a long question, or can also be asked as well as in the practical questions also. So this is a small list that I could make of the PDF. I have tried to explain you everything that you can be asked from the second year prof point of view. It is a holistic approach. This PDF I'll be sharing is this in my Telegram group, and you can really take a printout of it. It should be acting as a check mark to you whether you have read this or not. So any topic of this PDF, if you have not read, ensure you read it before the exam hall. I can tell you, if you can cover only these topics, is really more than sufficient. But however, it will come to your fact that you are not able to revise and read everything in the 3 months or 2 months or 1 month left now. In that scenario, just go to the last 2 or 3 years of exam papers and at least read those topics in your prof exam now. Any question that you have, you can surely remember this. But it's very, very important to understand that writing a prof paper is all about showing the examiner that you know about it. So how can you know, how can you tell someone you know it, or even write these things? And therefore comes the importance of writing papers in the prof. Okay, it's not an MCQ that you can mark 3 or 4 A, B, C, D and you get a 1:1 marks. So therefore there is an importance of filling up the papers, and do not be shy on writing the things. Ensure that you fill up the pages by some images that you can draw, by the flow diagrams that you can draw, and just please understand one thing: the more you write, the more marks you get. This is one thing you must remember. But don't be completely you don't write unwanted things. Be very to the point. Now what I mean by to the point is, first you write that thing, and if you know the same thing in a flow diagram, also draw the flow diagram below it. Okay, or you can do the reverse thing. You can first draw the flow diagram of it, and you can again explain the same thing in the below mentioned notes. But the time is again very important. Don't write so much in the long question that you don't get so much time in writing the short notes and the differences there. But I think I hope that this session was quite helpful to you all. I'll just ending the session with a small saying that the more hard you work now, it will stay with you not only for the secondary exam days, but will stay for you for the entire PGME preparation. Remember, because you will be having for the next exam, the more strong you are in the base of the second year and secondary, it will become more easy for you to grab the concepts of the final year things, and you surely will come out as a topper in your own exams. So guys, thank you very much for giving your valuable time. If you really like this video, put a like with this like button there. Just click on that, and please do share this video with your friends and anyone who is in medical college of your second year, because they can also watch this entire session and can be benefited how to approach a secondary exam. Not to get worried about it, just stay calm, but ensure that you write good amount of pages. But writing is also skill, and I told you how to make the best use of it. Thanks for your time. Wish you all the best. Take care, and if you have any questions, put in the comment box below. We'll again put a video, or we can put in the answer form, and we'll try to explain this again. Okay? Take care. Bye bye. Good night.